I'm just going to find my remarks in here somewhere. Hello. It's Antigone, by the way. And you should all watch Channel 7 at 11 this evening. I hate to do this, but I don't see my remarks here, so.
Antigone, I have some.
Thank you.
I don't.
Okay, well, let's see. I'm sure I'll find them if I just flip through every page. Forgive me. But I actually don't want to mess this one up because it's very important to us. Here we go. So first, this part I could have done without my remarks. Thank you very much for giving Facebook the opportunity to participate in tonight's event. We are honored to be included among so many people and organizations dedicated to addressing the issue of mental health. I also am personally grateful for this opportunity to talk about our work to enable compassionate connections on Facebook and our efforts to provide support for those dealing with depression and thoughts of self-harm. Facebook is a community of 1.5 billion people. And like so many communities, the people on Facebook look out for each other. We've seen people use Facebook to help find missing children. That's what gave rise to a tool built in partnership with the National Center for the Missing and Exploited Children that enables us, when a child has been abducted, to share missing children Amber Alerts with the people on Facebook located in the designated search area. We've also seen people come to Facebook to check on the safety of family and friends in a crisis. And now we have a product called Safety Check, specifically designed to quickly facilitate such checks during crises. After the attacks in Paris, over 4 million people marked themselves as safe using the tool, and more than 360 million people were notified that their friends were safe. And these are just two examples of how we are finding new ways to facilitate compassionate connections and safety on our platform. Perhaps what is most remarkable is that each of these tools is inspired by the extraordinary interactions we observe on our platform every day. Which brings me to one of our most recent launches and the one I'm here to speak about. One of the things we observed, based on the reports we get from our community, is that when people encounter really difficult content, like a friend saying they feel like they're hurting themselves, people really want to help, but they don't always know what to do or say. So we set out to address that void. Working with mental health experts and partners such as Save.org and Lifeline, we developed enhanced tools and resources for when people encounter this kind of content. In early conversations with these experts, we heard that one of the most helpful things for a person who is struggling with suicidal thoughts is to connect with someone who cares about them. And at Facebook, we are in a unique position to foster those connections. So we focused on building resources for both people who saw the posts and the person dealing with suicidal feelings. For the person who flagged the troubling post, we now provide options for them to call or message their friend, letting them know they care, or to reach out to another friend or a trained professional to support if they are upset or not sure how to reach out. For those who posted the content and may need help, the next time that person logs into Facebook, besides encouraging him or her to connect with a mental health expert at Lifeline, we give the person the option of reaching out to a friend right then and there. And we provide tips and advice developed with our experts on how they can work through their feelings. We also give them the option to skip the interaction altogether. I mentioned at the start that I am personally grateful to speak about this work. I am so grateful because, like so many of the people speaking tonight, I have a personal connection to these issues. This is the hard part for me. While attending college here in New York 25 years ago, my college boyfriend's twin brother committed suicide. What troubled me then, and has troubled me since, is that I knew he was suffering and wanted to reach out. But I had no idea how to help or what to say, which is why I'm so truly honored to talk about our new suicide prevention tool. It meets this challenge head on. And if it is all right, I'd like to ask the person who spearheaded the project at Facebook to stand up. Vanessa? There's more work to do, and I know at Facebook we're already working on additional improvements, but I'm really proud of what we've been able to accomplish with this help from all of this community here today. Thank you so much for giving us an opportunity to share some information about our tool, and more importantly, thank you for the opportunity to learn more about what your work and to participate in this event, and to connect with so many people dedicated to the mission of the Mental Health Association.